Welcome back to our Health and Science Focus. Now today we're discussing very, very important, pertinent subject, eating disorders. Let's chat now to Dr. Adri Kok. She's a specialist physician. We're talking about the physical damage that's done when one has such a disorder. Dr. Kok, a very good morning and thanks so much for your time this morning. You heard some of that interview with Dr. Tema a little earlier, just explaining to us what this sort of psychological aspects are or the psychiatric aspects are when it comes to eating disorders. I'd like to know from your side, do people understand, from what you've seen in your experience, do people who battle such disorders actually know what they're doing physiologically to their bodies?
Thank you very much. I think not. You know, oftentimes there's almost a neglect in their own mind that this is an issue, and so they don't understand the damage that they're doing to their bodies. We've often seen that a dentist would pick up that a person is bulimic because they pick it up on the dental and the gum disease that the person has, just because of the acidic nature when they do induce the vomiting. So it's really a disastrous physiological effect on the body. So they often come with electrolytes. You know, potassium is one of the important electrolytes that help us with muscle function and heart safety. And if your potassium is low, it can cause abnormal heart rhythms. It causes weakness. And with the eating side, they often also abuse laxatives to cause diarrhea, because the idea is that you lose weight when you have diarrhea. And of course, that causes a severe problem as far as your colon is concerned. So there's lots of impact on the body. Of course, malnutrition is very, very severe. They have protein loss, so the muscle is wasted. And over time, you can imagine that there is just no way that the body can survive such an onslaught.
Help us understand, you know, what it is, or give us some, and I don't mind if you want to sort of get quite shocking and graphic here, because I think people need to hear it, Dr. Kok. Just what are some of the worst cases you've seen? What's been some of the worst damage you've seen a person do to themselves because of an eating disorder?
Well, I think death. You know, people die from this at a young age. I've seen a person with cancer of the esophagus, of your swallowing organ, because of this constant acidic reflux that you get when they induce the vomiting. So it's absolutely a disaster as far as the individual is concerned. So death, of course, because of the abnormal potassium, patients go into kidney failure. They have dehydration because they keep up with fluids, but then of course they lose the fluid, so they get kidney failure very easily. And of course, over time, that protein loss that you have, the malnutrition, you just can't build up muscle. So they become very clever at hiding food, for example. And as the doc said before me, that that often the family may not recognize the symptoms of what's happening, and they just think the person is a thin person, and they have, you know, some people think that's a good metabolism. In the meantime, that person is desperately ill. So we've seen situations where this has been neglected because the family just didn't understand how sick the person was. And so when the person then comes to hospital and we try to resuscitate them, you have to have a very careful refeeding. You can't just start giving them food. You often have to use a nasal tube called a nasogastric tube, because they hide the food. I've seen them hide food in a magazine.
Wow. In
the pages behind in the magazine, they put the food in the magazine so that you can't see. That looks like they've eaten, but they haven't eaten. You know, they hide the food in their clothing. It's a real. Can I call it? It's tragic for them to get to that kind of situation. So yes, death, severe malnutrition, cancer risk, end-stage colitis, where the bowel gets damaged from the laxatives, for example. So there's no good outcome. And as the doc said before, it's almost like a person who stopped smoking. It's just another day they haven't smoked. They're not really an ex-smoker. This is the same thing, that it's a lifelong situation where this person has to have support throughout the rest of their lives.
You know,
And often they do die at a young age, unfortunately.
what's the youngest person you've seen pass away from something like this?
26 in my experience, and I've been 30 years in practice. But you know, it's the sort of the steps before this happened to the point where the person is admitted to hospital. That's just tragic, because as much as the psychiatrists and psychologists have tried, and they have special dietitians to help them to slowly refeed the person. We've even used intravenous feeding just to get the person's physiological profile more stable. It's a very difficult situation to reverse.
Doc, how long after somebody starts sort of, behaving this way and giving into this kind of behavior, how long after do you see the damage being done to, like you say, for example, teeth, organs? How long does it take to get to that severe stage?
Yeah, difficult to say. I think it depends on the individual and their sort of physiological makeup. I think some people can tolerate this kind of behavior for longer because their body's just, their constitution is just stronger. But again, so it's difficult to put a timeline on it.
Yeah.
But I think the difficulty is, again, once it's happened and the person is in a very severe state of malnutrition, because they're basically malnourished. It's as if they've never eaten, because you can imagine they never get nutrients into their body.
Yeah.
And so it gets to the point where they then start having, blackouts because their blood pressure is low. They have these abnormal electrolytes, their salt levels fall, magnesium levels, their calcium levels will be abnormal, so they get osteoporosis or thinning of the bone structure. So all of these, it's difficult to give any time period.
And Doc, I mean, obviously I would imagine that something like this could also heavily impact somebody's ability to sort of live and go on, for example, to have children or battle other kinds of illnesses, that kind of thing.
Very difficult to have children. It's not impossible, but oftentimes they physiologically so impaired that they also don't have normal periods. Mainly women, obviously. Mm-hmm. I've not seen many men with the situation. As the doc said, it's mainly in a certain group that could be seen. It's mainly women, and it's mainly the younger age where there's a lot of peer pressure about this body image that creates this. And I think, again, there's this expectation that you have to have this perfect image of yourself. And the person sees themselves as being fat. So they could weigh 30 kilos. The lowest I've seen was 28 kilograms in an adult woman. You can imagine 28 kilograms, that's a growing child. Wow. And it's that situation is so difficult to reverse. Even if you have the best psychological and psychiatric support possible, it is very, very difficult to reverse it. Right. Because the person's image in their mind is that they are a fat person.
What they're seeing in the mirror is completely different from what the rest of us see. Thanks.
Exactly. It's the perception of themselves, sure.
Thanks very much, Dr. Adri Kok. They're just laying it bare. That's what happens to the body. It's sometimes irreversible damage. It leads to death. It can lead to death. Well, still to come here on the program, I'll be speaking to clinical psychologist Giada Del Fabro about the psychological aspects when it comes to eating disorders and treatment of them as well. That's on the way.